Hi, welcome to ScanLab. Today you'll be taking one or more skill assessments in computed tomography. The purpose of this assessment is not to get you into trouble and does not reflect negatively on you as a qualified CT operator. The purpose is to accurately represent your current understanding and skill in some of the main areas in clinical CT to localize opportunities to grow your individual skill if that's what's needed. Within the skill assessment, you'll be asked to perform specific tasks and answer specifically prepared questions in multiple formats and across multiple categories. In order to understand your technical skill, none of the sequence parameters or settings or slice positions that you were initially presented with are correct. Each parameter across each clinical activity needs to be checked for correctness and adjusted in order to accomplish each question objective. That's very important. It's important for us that you feel comfortable and confident with the assessment environment. That's why we allow you to select your preferred language, vendor, and injection method that you have the most experience in and that you're most comfortable with. By providing you access to the testing environment that closely resembles your clinical environment, we can ensure the data we acquire is an accurate representation of how you perform in real life. For contrast examinations, you will be presented with a ScanLab digital injector interface. You can choose which injection format you plan to use within the settings on the assessment homepage. Test means that you plan to inject a small amount of saline prior to injecting contrast. Bolus means that you will directly inject contrast. Time to peak means that you will inject a small amount of contrast first, followed by a larger contrast bolus. And biphasic means that you will subdivide the contrast into various amounts and flow rates. In certain ScanLabCT examinations, you'll be introduced to the digital patient. You will need to choose which contrast arrival method you prefer to use when determining the contrast arrival time. Set delay means that you will use a certain delay time to start the scan after the start of contrast. Bolus tracking means that you will use an ROI combined with a Hounsfield unit threshold to trigger the start of the scan. Test bolus means that you plan to inject a small amount of contrast to determine the arrival time of contrast within the vessel of interest. Whether you use set delay, a bolus tracking ROI, or a test injection, ScanLabCT can support it. This skill assessment should always be taken on a computer while using a mouse and not using a trackpad. Never attempt a skill assessment on a tablet or a smartphone. Only use ScanLab within the Google Chrome browser. Within some CT activities, you'll notice a glowing criteria box. In CT, sometimes there are more than one acceptable way to angle and reformat a slice group. This feature allows you to select which method and angle you'll be prescribing the slices according to within the activity. For multiple choice questions, if the answers have round icons, there's only one correct answer. If the answer options have square icons, that means there are two or more correct answers for the question. In an effort to capture what you truly know without having time to look up the answers to the question, each question activity is timed. The assessment will automatically submit when time expires, regardless if any unanswered questions remain. A practice examination is available for you to take prior to starting your skilled assessments. This allows you to be familiar with our interface and overall examination structure. The practice examination can be taken multiple times. If you experience lag within your skill assessment when you're trying to angle slices, you need to adjust your frame rate, check your internet connection, or update and configure your Google Chrome settings for optimal performance. A checklist of recommended best practices are found within the tips area on the assessment homepage and must be confirmed prior to continuing on to your skill assessments. It's also incredibly important to familiarize yourself with the ScanLab policies, which are also found on the skill assessment homepage. These policies provide important guidance for safety practices within ScanLabCT. Also, it's really important that you know that within the ScanLab interface, just like anything on Windows, you can be able to hold down Control and plus or minus, or use your middle mouse wheel to be able to change the aspect ratio of the ScanLab interface. And you'll need to do that because we really don't want you to have to scroll up and down, so take your time and make sure to do that. You can watch this tutorial as many times as you like, and you can take as many practice examinations as you need prior to starting your exam, but make sure you understand all the functionality. Once a skill assessment has been started, it cannot be paused or started over. It must be completed. Good luck on your assessment.